Monday afternoon, the Standing Committee on Health and Human Services heard testimonials regarding LD 1159. Sponsored by Representative Lori Osher of Orono, the bill would allow for the creation of overdose prevention centers across the state for 2 years after its approval. Those centers would provide a space for people to use pre-obtained substances under the supervision of addiction medicine physicians and nurses.
There's a whole suite of services that are already legal and available. This is the one piece that is not legal yet. So this bill says that people can bring the drugs that they have found or they have purchased or whatever into this place, and that the people who are working in that place will not be held liable for that.
Osher states that the centers would also provide resources for drug rehabilitation. According to Osher, LD 1159 has received tripartisan support from Republicans, Democrats, and independents alike, despite opposition for the bill coming from Governor Janet Mills.
It's unfortunate that it's taken this long to be talked about in such a way. Even colleagues of mine have lost loved ones to overdose deaths. Every overdose is a policy failure.
By itself, LD 1159 doesn't guarantee the creation of any centers. Whether or not they come about is the decision of individual communities.
And actually what's embedded in there is that the communities have to approve it. It will only be in places where the town says that they want it.
Osher says if a community was to decide to create an overdose prevention center, it would cost Maine taxpayers nothing.
Why? Because our state is one of the states that's sued for the opiate producers, and so we have opiate settlement money, and so if this bill passes, that we would be proposing to request funding from the opiate settlement money.
In Augusta, Devin Dagnall, ABC 7 and Fox 22 News.